spine healthy, and also managing it if it becomes unhealthy and starts to hurt you, and exactly what to do. From presenting research, the spinal decompression, everything about epidurals, facet injections, ablations, microdiscectomies, fusions, and on and on and on. So we talk about all those subjects, but today we're going to talk about how to keep your neck feeling great. So if you're on live with us today, wait for a couple people to get on. Say hello, please. Give us a wave. If you have questions, we'd love to answer those for you while we're together for a few minutes, and just be able to bring some value to your life that will make a big difference in your life for you. I guarantee it. If you don't know me, Dr. Shawn McWilliams. I've been doing this for over 25 years full time, and now I get to come to you around the world every Wednesday and bring some joy to your life, hopefully some laughter, but also some great information to make your life much better quality, and so that you feel better, because when we feel better, life's better, right? So what we're going to talk about today is we're going to talk about one of my favorite neck stretches. There's a few neck stretches. If you look back on some of my other lives, I showed you sitting chair neck stretches if you're sitting at work. Today I'm going to show you a new one, and it's going to be using this guy right here, one of your old favorite socks that maybe has lost its brother or sister or cousin. And yes, these are my guitar socks. If you don't know a whole bunch about me, yes, I do enjoy strumming on a guitar and playing with my boys and some friends. So that's why we're going to use Mr. Sock, Mr. Guitar Sock today. So what we're going to do with this, and the reason I'm showing you this is because this is something really simple that you can keep in your drawer, in your cubicle, or close to your desk, and just pull it out, and this is all you need. You don't need any fancy equipment, and you definitely don't need to buy something, because we all have an extra sock somewhere. So what we're going to do with this sock is we're going to be using it to help improve the glide of the spine, specifically in the facet joints. And what does all that mean? Well, you don't need to know, but I'm going to show it to you anyway. So what I'm talking about here is, when we look, if you've been with me before, is this part. I'm looking for... So this part right here and this part right here is called the facet joint. It's made up of one bone here and the other bone over the bone below on both sides. And what's that facet joint do? It allows the spine to have movement like that. And when you add all the segments up of the spine, that's what gives you all this great range of motion in your low back, mid back, or neck. But the neck has the most range of motion in it, and unfortunately sometimes can really reduce its range of motion if we're on computers, or we're spending a lot of time doing this stuff on our phones, which, you know, I'm not a big fan of. So we've talked about that on previous lives. We want to keep that phone up like this. So please, if you haven't gone back and watched those, please hold your phone up like this when you're texting and emailing and just scrolling through stuff versus that, okay? So this is going to help you a lot. So what you're going to do is you're going to get your sock, okay? And we're going to put it back behind our neck like this. Give you a little different angle, all right? And what you're going to do is just going to create a little bit of pressure forward. So I'm going to pull it gently forward. And then what you're going to do is just going to nice and easily bring your head back. No pain. You can hold that for a few seconds. Take a little bit of that pressure off. Then you're going to do the same thing. So you can see I'm all the way at the base of my neck. Pull. Bring your head back into extension a little bit. And come back to center. Then what you're going to do is you're going to move it up a little bit. Not too much, because remember, there's 7 bones that make up the neck, so we want to make sure that we can get all of them. And then same thing. Pull slightly forward. Let the head come back. Hold that for a few seconds. Move it up a little bit more. And when I say a little bit more, I'm talking about 3/4 of an inch, okay? Slight pull forward. Head back. Hold it. Relax. Slide it up the head a little bit more. I'm going to put a little bit of upward pull here, just so it stays and doesn't slip down my neck. That's a great one. And then what you can do is, when you get to the base of the skull, we can hook underneath the base of the skull and just do a gentle pull-up. Like I am elongating the spine, like this. So right at the base of that skull, that occiput bone, we want to help pull that up. So then what we can do is we can start there then. Okay, gentle pull. So you can kind of see how I'm like anchoring it right there. and then come down a little bit, slightly pull forward, head back, down a little bit more, pull forward, head back, down a little bit more, pull forward, head back. And you want to keep your hands out like this. Don't do this or you're going to choke yourself. Hands down, this, pull forward and back. And then take it off. You can do that a couple times a day. That's going to make a really big difference. You're going to feel much looser. You're going to be able to go back into extension much easier. And you're going to just improve the biomechanics of your spine. So I hope this has been really helpful for you. We have lots of great tips and tricks. If you go look at our Instagram or Facebook or YouTube, there's lots of videos that we create every single Wednesday to help you have better spinal health and just feel better. Because remember, when we feel better, life is better. We want to do more things. You can be a better spouse, a better partner, a better parent, right? Better teacher, better employee. Just go enjoy life, how it's supposed to be enjoyed. It's a beautiful day here, like it normally is on Wednesdays, which is really fascinating to me. And I hope this really adds some value to your life. If you have questions, please don't hesitate to say hello. Leave me a message or write me a comment. I look at them quite frequently and would love to answer your questions. And if you have a topic that you would like to know about when it comes to spinal health, fire away. Please leave us a DM. We're happy to answer those for you. That's where I get most of my content from anyway, is comments that people leave and ideas that they have or they want to know about. So that's why we create these short little lives to go over these subjects with you. So I hope this has been really helpful. Please say prayers for the people in Florida and in Georgia and North Carolina and South Carolina who've been really hit hard by this last Hurricane Helene, and of course the one that's coming through, which is doesn't sound like it's going to be good, Hurricane Milton. There's a lot of people trying to get out of Florida and unfortunately can't right now because there's no gas. So I hope that you will ask God to bless them and keep them healthy and safe. We have a lot of friends and family down there, so and we will definitely be doing the same. I will see you next Wednesday, same time here on YouTube at 1 o'clock. And leave me a message, and please go take a look at our website. There's some great information on there. I answer a lot of questions for people. You can go and take a look at Disc University. It's the course that we created if you are suffering with bulging and herniated discs and you don't want to have surgery. Spinal decompression has about a 90% success rate. We have 2 courses on there, one for the neck and one for the low back. I've worked really hard, so over 25 years of experience to teach you exactly how to do it from your home. Yes, I said that correctly, from your home. You can manage bulging and herniated discs. I've had lots and lots of patients who have done it, and I can show you amazing pre and post MRIs of their changes over 12 weeks. It takes about 12 weeks to do that, but you're getting your discs healthier and reducing the expansion of the disc, getting the nerves to help regenerate, getting the discs to rehydrate themselves, everything that you really need to have long-term success with this versus just going and doing like a microdiscectomy and cutting out part of the disc while the rest of the disc stays diseased and continues to get more disease. So I hope you go take a look at that. If you go look at our website, it's on there, and happy to answer anything for you. So I hope you have an amazing day. Thanks for joining us. Thanks for being part of our family. We're here to be the global leader in non-surgical spinal repair. So if you got questions about the spine, I want to have answers for you. And I do a lot of reading. I study a lot of research on this so I can bring you some of the best information and so that it can work in your favor if you don't want to get surgery. And I don't recommend it. I think you should always do spinal decompression first and do stuff that's non-invasive. Do it for 12 weeks. If you're not better, then you can always go and take that more invasive approach, but you'll be amazed. Most people in 12 weeks are back to a pretty damn normal life and feeling great and being healthy, not just numbing it or cutting it out. So go take a look at it. I appreciate you. We'll see you next week. Thanks for being part of our family.